All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the How to Stay Healthy show, living a longer and healthier life. Tonight, we're going to talk a lot about ManorCare Delray, our neighbors here in Boca Raton, so that's great. And I know they're a huge company. I know that part of Heartland as well. You may remember that. That's actually where I first knew you guys. So without further ado, I want to welcome Joshua Perez, ManorCare Delray. He's back. He's an LPN nurse liaison. You were on March 5th. I looked back, March 5th. So welcome back, Joshua.
Thank you guys so much for having me back.
And Perlinda Holiday.
Hi.
From HCR ManorCare.
Yes.
You're a hospital liaison.
Yes, that is correct.
So tell us a little bit about what you do, because we already know what Joshua does.
All right, awesome. Well, I actually go out and visit patients in the hospital and see those that require assistance with rehab or any type of rehabilitation into a skilled nursing facility, and just try to assist the case managers in the hospital with directing them into the various skilled nursing facilities that we offer.
So I know you mentioned we're here in Palm Beach County. Do you just work with the Palm Beach County hospitals, or does it extend?
Well, currently my assignments are the Bethesda Hospital East and West, and also JFK, which is located in Lantana. And out of those various hospitals, we service the Palm Beach County skilled nursing facilities.
Great. I know those hospitals very well. I actually live by one of them, the east side on Bethesda. My friend here as well. We're over there, a great area, revitalizing. It's amazing. We were talking about that in the green room. But that's great. So you work with all three hospitals. JFK, we've had a lot of doctors on from JFK Medical Center, a lot of heart doctors, actually. It's a really good heart hospital.
Yes, very excellent.
I was right on that.
Yes, excellent.
And then Bethesda, wow, they've come a long way. That's a pillar of the community in Boynton, the east side. And then the new one out west, I haven't been inside, but I drive by it all the time. It's amazing looking.
It's beautiful. I think they're about 6 years old now, that Bethesda West Hospital, and they also have a phenomenal heart institute within their setting as well at Bethesda. Yes.
Good to know. And that areas out there is really growing, that community out there. I drive home that way sometimes off 441, so I see it. So they were really ahead of on the ball on that one.
Yes.
Joshua, before I forget, tell us what you do. I know we talked a little bit about last time, but you're a nurse liaison, so you're an LPN. Explain a little bit about that.
Absolutely. So my job when we're stepping in, I cover the Delray Center. And basically my job consists of going out and assessing clients, ensuring that they meet the appropriate needs for our facility, and ensuring that we can meet their needs and get them back into the community safely and in a timely manner.
So the people may, these are mostly seniors that you deal
Correct.
with? Obviously, okay. And wow, that baby boomer population, I always look that up because, that's the fastest growing population in the U.S. for right now.
Yes.
So it's great that you guys are here in this area and that that type of care is offered because, whether it's a fall or maybe someone breaks a bone, most people will need that type of long-term recovery. And we've talked to a lot of doctors and the hospitals, they only want you there a certain amount of time until you can be kind of moved
transition,
through.
Right?
Transition, there's a good word. And that has a lot to do with infection and other reasons, but because they want to make sure that that type of care is available. Now, do you at heartlandmanorcare.com, or we'll just say that's the website, heartlandmanorcare.com. I'm reading my notes here. But it's ManorCare Delray. Is that insurance or private pay?
Oh, well, so it's a ManorCare in a whole. Most of our facilities accept pretty much the same insurance policies, with the exception of ManorCare Boynton Beach, which also accepts Humana. But we accept private pay and all different types of insurances, with a very small handful of insurances that we do not accept, and a very small amount.
And also the traditional Medicare clients we accept as well, and some additional Medicaid patients.
Okay, that's great to know. Actually, the Vice President of All County Healthcare, who sponsors this show, we actually do a Medicare show a few times a year, normally a little before open enrollment.
Okay.
So we try to bring some information out there, because I know everyone's making those type of decisions. So, Joshua, what brought you to ManorCare Delray? I know that I asked you that last time, but I think it's interesting to the viewers.
Yeah, so I actually came from the Miami-Dade and Broward market up to Palm Beach. We actually were purchased by a company called ProMedica, and they actually got rid of a few of the buildings down in Miami-Dade and Broward through a sale, and the ones in Palm Beach now are backed by this brand new company that is out of Ohio. It's ProMedica and Welltower, and our company right now is getting funds. We're getting renovations started, so here within the next year, we're going to have so many different things to offer to the community. We're really excited about this new opportunity.
And Perlinda, what brought you to ManorCare Delray?
Well, I always wanted to work for a company that would be able to provide good quality care, and I believe that ManorCare really strives to offer that to their clientele. And I think ManorCare has been proven as a proven leader in the industry. We are nationally known. We have companies who have facilities all over the United States. And I think it's just a good opportunity for me for growth, and I feel like, the stars are the limit. The sky's the limit.
And that's great. It's heartlandmanorcare.com.
Yes.
Great website. I'm always going on there. Last time before you came on, there's a ton of info there.
Great.
Wow, I was on it today, and I was just amazed at the size of the website. I know you guys are a national company. It does make sense, but I always do give a shout-out when there is a great website, because I think nowadays people make a lot of decisions. Family members make a lot of decisions. Friends chime in, and
Absolutely.
if you have a great website, it kind of helps to navigate the process a little bit. And nowadays it can be tough. I've had some health issues in the last few years, and just navigating the system.
Yes.
It can be tough. So if you have a platform like that, I think that's very helpful. And it actually goes into my next question. So, do you offer both short-term care and long-term care?
We do. We absolutely do. We have some patients that will come into us directly for specifically long-term care, but I would say the bulk of our clients are really in for short-term rehabilitation, coming in to rehabilitate from such things, hip fractures or CVAs or wound care. We provide IV therapy for patients. But we do have some patients that also come in for what we consider respite care, where, perhaps a patient is receiving, if a patient requires, or a patient's caregiver requires some time away and they need a week or 2 weeks off, we can provide what we refer to as respite care.
Absolutely.
Oh, that's a great point, because I didn't even think of that, but that can be draining on an individual, whether they're trained or not. And actually the show before us, Marsha Teal's show, is actually a whole hour on caregiver info and connection. So I'll give her a shout out as well. But that's great respite. I did not know about it.
Yes.
See, I'm always learning stuff on this show. That's why I keep this show going. And really and then also, Joshua, long-term care as well is something that you guys do?
Absolutely. The same services offered there, same services offered here. We do long-term, short-term, and we do the respite care as well.
Well, you guys are a big name. That's what I kind of started before I was stumbling over my words there, because I've known that name for a long time, but it's really good to have you both here to learn a little bit more about what, and I'll give out the website, heartlandmanorcare.com, but I'm looking at your badges there. You guys are both HCR ManorCare.
Yes.
And,
Helpful, caring, and responsive.
Oh, okay, that's the acronym.
Right.
Helpful, caring, and responsive. I'm glad I asked that. Now, memory issues in this country, whether anything, if you want to tie it to sports and concussions, but then you want to, or if you want to tie it to other maybe environmental issues or whatnot, memory disorders and issues seem to be just prevalent and growing in this country, on the rise. So, is there a focus at HCR ManorCare for memory care?
We do. We actually have a skilled nursing facility that specifically caters to those patients with cognitive issues, and that facility is Heartland of Boynton Beach, which is under the ManorCare umbrella. It's a 120-bed skilled facility that specializes in dementia and Alzheimer's care in the community.
Oh, nice, and that's great to have in our community.
It's located in Boynton.
Okay, 120 beds in Boynton Beach. And you mentioned Alzheimer's disease, and I've had a lot of neurologists on this show as well. We've talked about dementia, early onset dementia. I actually was reading a story about a women's basketball coach who passed away from early onset dementia at a very a very young age for what you'd expect for that disease, and they both seem to be growing those issues. And you mentioned cognitive, that all goes together. Anything where the brain is impaired for any reason. So you guys also specialize in that. It's heartlandmanorcare.com. You can get a ton of info there as well. And now, Joshua, I'm going back and forth. This is great.
That's
I can just bounce back and forth.
And anything that I miss, she picks up, and I love it. And I absolutely
team.
did. And I didn't mention respite care. It's a great thing that we absolutely offer, and that's something that a lot of people should when they have these caregivers. Caregiver exhaustion is huge, and that's something that is a big thing that we can offer for them.
Yeah, I didn't realize that until you see a family member or a friend, and maybe they have a family member, and then someone's helping them out, and just the wear down.
Quite often it happens a lot when you're dealing with an Alzheimer's or dementia patient, when the caregiver is stressed, as far as taking care of them, and they require a little bit of time just to take care of themselves. So respite care is something that we often provide.
Yeah, and that can be sometimes frustrating for the caregiver as well. I know in the case that I experienced, a family member sat at the end, but there was a thing during this time of the day. I believe it's called
sundowning. Yes.
Yeah. So actually saw that. Had a neurologist on, and then a few months later actually saw it in person, and then I got it, and I was like, okay, yeah, that is something I didn't know anything about as well. And you definitely have to have someone around. When someone has a memory care issue.
Absolutely.
Because just anything
they can't be alone, right?
Maybe they're on a certain prescription that's helping them to live a healthier life, and maybe they forget to take it. It's good to have someone there.
Right.
What we talk a lot about on this show with a lot of doctors, because we're really geared towards baby boomer and the aging population is falls as well.
Oh, yes.
And what I experienced as well as, the person maybe hadn't remembered that they fell, and that can be an issue because if you have internal injuries, they need to be looked at as well. We have about 30 seconds before we're going to take a quick break, but I'm glad to have both of you on the program. It's heartlandmanorcare.com. They do rehab, nursing, short-term care, long-term care. We learned about respite care today as well. I have had some different organizations on. I haven't heard that, so the kudos to you guys for bringing that. Memory care, Alzheimer's disease, dementia, early onset dementia as well, cognitive disorders. I'm sure traumatic brain injury goes right with that from maybe a slip and fall. But before I get too much overboard, let's take a quick break, and on the other side, we'll talk a little bit more about HCR ManorCare Delray. Great.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
This one.
Hello,
right.
South
Okay.
Florida. Hello, South Florida and beyond, and welcome back to the How to Stay Healthy show. And we're telling everyone about HCR ManorCare Delray and HCR ManorCare Boynton.
Yes.
I finally got it right.
Yes.
So Joshua Perez is here, nurse liaison from ManorCare Delray, and Perlinda Holiday, and hospital liaison. I practiced liaison today a bunch, and it's really working. I'm surprised about that with HCR ManorCare Boynton as well. So you have a medical director at HCR ManorCare Boynton?
Yes, we do. Our medical director is Dr. Marty Jacobs, and he's been there, our medical director, for about 6-7 years. He's been there for a long time, so we have a lot of tenure there with him. We have an excellent administrator there, Dr. Gregory Lielsi. He's been there and doing phenomenal work there in the building.
Nice. And where are you located in Boynton?
Our address in Boynton is 3001 South Congress Avenue. And just in case, if anyone would like to call, the telephone number there is 561-737-5600.
That's great. Or there's info at heartland-manorcare.com as well.
Yes, and as far as the dementia facility that's located in Boynton, that one would be the Heartland of Boynton Beach facility, and their address is 3600 Old Boynton Beach Road in Boynton, Florida, and their telephone number is 561-736-9752.
9752. We will give those out again before the end of the program. I actually know Boynton very well, so I know exactly where both of those are. I have driven by Heartland many times, so I'm glad I found out what actually is going on there. That's great, though.
Perfect.
That's the 120-bed facility.
Yes, yes.
Wow, that is not a small facility at all. They're pretty good for our community.
Yes, and ManorCare of Boynton is actually a 170-bed facility.
Okay.
That's a little bit bigger.
Whoa.
Yeah.
You guys aren't a very small organization, but we like that in this type of care as well. We talked a little bit about long-term care, short-term care, memory care, etc. Now, what is a post-acute care after a hospital stay? Is that still like in the short-term care category?
Correct. That's usually when patients are discharged from the hospital and they come post-acute from the hospital to us, which is what we refer to as subacute within our setting for short-term rehab.
Can that be as little as maybe they only need 1 day, or maybe they need X amount of days?
Well, typically, it could be as little as 1 day, but typically the stay is a little bit longer. I would say the average stay could be anywhere from a week to 2 weeks, something like that. Sometimes people will come in for a duration of IV antibiotics or something like that. But on average, the stay is about a week to 2 weeks, depending on what the person needs and how they're progressing with their plan.
And then obviously nurses in your organization, you mentioned the medical director rounding through as well, a doctor right there as well. So that's good to know. Again, it's Heartland ManorCare, HCR ManorCare in Delray and Boynton Beach. We're lucky to have Joshua Perez here, LPN. So that is licensed professional nurse, right?
Licensed practical nurse.
Licensed practical nurse. So you actually have a nursing background.
I do, absolutely. Actually, prior to this, I was actually in therapy as well. So I kind of did a cross-reference of physical therapy and nursing, and it helps me to go out there and make an appropriate decision to make sure we get the people the help that they need.
And you're still, do you actually serve as a nurse as well, or you just keep that going, your certification? Is that how it works? Because you're more of an administrative role?
No, so I do go out there and I assess. So when I go out there and assess hospital records, I'm looking at diagnoses, I'm looking at notes, I'm ensuring that this patient can tolerate our therapy. And if not, then we will find them the appropriate assistance that we have. So if we can't help them, we're going to find you the help you need.
Absolutely. We want to be a resource. So sometimes if it means referring them to an assisted living facility, if necessary, or if they need, and we have had patients to come to us and then perhaps have to go to an acute rehab as well. So we kind of work with all of our different agencies that we can help and, cross-refer patients to.
Now, and you mentioned before, this could be anything from a broken bone, wound care. We talk a ton about wound care on this program with vascular surgeons. The podiatrists want to talk about wound care, and I've learned so much about that. I had no idea that, what can happen if it's not taken care of possibly. And then I had a family member break a bone and then had a wound from actually the surgical procedure, and I've seen that firsthand, how that's going. So I totally see. It's important to get care.
You've been a caregiver prior.
Yeah, it's important to get care when you have something that's not right, and especially if a doctor orders it, or the organization. Definitely stay on course with that, because you definitely don't want to lose a limb or amputation or something that can a couple months of hardship for the patient. Is much better than the end result, what could be. So,
absolutely.
Do you also do outpatient rehabilitation?
Some of our centers do outpatient rehab. Yes.
Nice. Wow, you guys do it all.
And just to share, at the Boynton location, we just started a very new program that's and we've seen some success with it. It's the LVAD program for the left ventricular assistive device. Currently, that's something that we have started, and we're partnering with JFK Hospital with. So we've had a few patients, and they've had some great success with us, and we're looking to see more and treat more of those patients.
We have a lot of connections. We didn't even talk before the show. The first doctor I ever had on this show right here did an LVAD.
Stop.
Yeah, Dr. Brian Bethay. He's a cardiac surgeon.
Yes.
Yeah, he with Delray Medical Center.
Yes.
Really?
He was my first ever guest. And I was so nervous because I didn't know if a cardiac surgeon would really show up to my show.
Wow.
Until he was sitting there, I didn't think he would, but he explained LVAD. So I don't have to explain. You kind of said it was, but it's pretty much that is a huge procedure. That is someone, if they don't have that
Very
procedure,
sterile,
they're not going to be able to live any longer.
Correct.
And he explained the left ventricular assist device, and we got to see the device. And actually, we got to interview the patient a few different times, and he was very open about the whole process. But to know that you guys are working on that, that is huge, because that can save someone's life. I mean, if that's ordered for you and you don't have it, you need that to live.
Yes, definitely.
That's like the last thing. This guy, he actually wouldn't have been able to make it if he didn't have the LVAD.
Yeah.
So that's great. So they're doing that at JFK now. That's great to know.
JFK, and partnering with us at ManorCare Boynton Beach.
Okay, ManorCare Boynton Beach, and then JFK is right in Lantana, Atlantis.
Lantana, yes.
Yeah. I drive by that one all the time as well. I kind of jotted a couple things down for your website, and this is kind of tie into all the doctors we have on this program. So you guys do cardiac care, diabetic care, oncology care, neurology, obviously ortho and joint, because that's broken bones. Family member I had broke her ankle, and she's older and has osteoporosis, so that was that. Pulmonary care, we talk a ton about that. 5 years ago, I didn't know even what COPD was.
Oh, wow.
To be honest with you, in the way it's grown. And just to know that you guys do pulmonary care as well. You mentioned neurological.
Absolutely.
That kind of ties into the memory care, but also can be other issues. We got about 2 minutes.
Yeah,
Hard to
whether
believe.
it's a stroke or whether it's anything of that nature, we have the assistance. And, you know, our staff there is extremely educated. From a broken bone to a very severe sickness, we've taken care of all of it.
Yeah, you guys have seen it all. And you have a national organization to rely on as well, so that's great. Wow, what a great organization. It's HeartlandManorCare.com is the website. Locally, we have Joshua Perez here, LPN. He's HCR ManorCare Delray. And Perlinda Holiday is hospital liaison, and she's ManorCare Boynton Beach, which has 2 locations in Boynton Beach, 3001 South Congress Avenue. The number there is 561-737-5600. Thanks, I did my chicken scratch there. And you're also over off Old Boynton Beach Road.
Our dementia.
Yep, dementia, 561-736-9752. Well, I hope you'll join me back on this program in the future, and we can talk a little bit more about what your organization is doing, HCR ManorCare.
Absolutely. It'd be our pleasure.
Yeah, thank you so much for having us on.
And thank you, both of you, for joining me.
We'll
see you next
everyone who
time.
tuned in.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.